What an
Yeah.
amazing way to explain to people the story you always hear, or I think the story that most people assume is that these people, they're lazy. They don't want to learn about this stuff. They want to continue their lifestyle. They want to continue eating whatever foods they were eating before. You also hear it on the healthcare end. The healthcare system makes tons of money. They don't have a lot of time. They want to get paid by insurance, so they're not really interested in this stuff. What you're describing makes me think that a lot of people are really interested in this stuff. And once they learn, once they get the information, compliance is not necessarily a limitation. People like it. They understand it once it's explained to them. Has that been your experience?
Absolutely. I would say that healthcare professionals often label people as non-compliant or non-compliant. And I think non-compliance means that two different individuals have got different goals. And so I would never label anyone non-compliant. I'd work with individuals. We work with individuals to find out, what are your goals? And we never ever tell anybody what they should or shouldn't do, because as adults, we hate to be told what to do. I'm a rule breaker. Someone tells me something to do, I do the opposite. And so we work with people, what is your goal? And how do you think they set their own goals? So at university, they say at university, half of everything we learn is wrong. And I learned what was wrong with my university training is that I should set goals for people, because that simply doesn't work. So when I was doing all the clinics, people would come back because they like me as a person, but either they would fabricate information because they wanted to please me, or they would just kind of say, oh, well, make excuses. And that's not helping them at all. I wasn't helping people. I just got so frustrated. And so one of my rules now is not to set things for people. Let them, everyone knows what they're capable of doing. And so by working with people, they can come up with their own suggestions. And those suggestions are so much more powerful than the suggestions I could make for that person.
Wow, that's amazing. That's such great advice as well. We used to have to do weight loss contests at the gym we used to work at. And once we discovered that low carbohydrate diets would work really well, and I could validate on a metabolic cart that it would improve somebody's metabolic rate and also their fat burning percentage all the time, we decided to, take our groups that were doing weight loss contests and give them low carbohydrate meal plans and, some really simple recipes versus the stuff we were giving them before that had lots of fruits and vegetables and whole grains and all that stuff. And you're right, like the compliance percentage that we noticed went up by several points. We were having compliances of people sticking with the program for a 60-day period of time at somewhere north of like 65%, where before the program we were running was like 15%. It was totally different. And you could tell, like, yeah, these people in the beginning, they don't really understand exactly what they're getting into. And we're saying things that are a little bit different than what they've heard before. But once we could explain like what was going wrong with the diets they were doing before and why they had always failed, and we presented a different case, people were very much willing to try something new and something different. It made sense to them, maybe for the first time, that yeah, if you're following the conventional advice, it's not going to get you there, and it's not your fault. So can you talk a little bit about that, about how what you were taught in school is bound to make people fail eventually and make people feel that they were the failures when really it was the failure of the advice?
Yeah, like I said before, when you see people initially, they're often very, very underconfident, and that's because they feel their lack of success is down to them and they've gone wrong somewhere. And so one of the activities we do is that we say, okay, then a typical weight loss diet creates an energy deficit, and we show the labels. Now we have them all digital, so rather than having just the magnetic boards and the labels, we have digital boards as well. And we say, people are educated or told to have an energy deficit. So they're told to eat less and move more. And does that result in weight loss? Of course it does, initially. So initially people count their calories, and they count their calories for, say, a 500 calorie deficit, and they move more and they get on the scales and they have lost some weight. So they feel good. And then they get that dreaded plateau. And when they get the plateau, they think, oh, it's my fault. I'm not trying hard enough. I'll try harder. And the plateau still remains, because what they're not educated on is that calories in and calories out are linked. So if you reduce calories in, the metabolism slows down to match it. If you increase calories out by burning more, the appetite goes up. So people feel hungrier. And so that's never been explained to them. So what do people do? The weight loss has stalled and they start to feel fed up. And so gradually their favorite foods come back in. And so then they see the weight gain, and then their set point, their kind of internal thermostat goes up. So the after story from a weight loss diet, a traditional weight loss diet, is weight gain. They end up being bigger than they have before. So often when people are diagnosed with type 2 diabetes and come to us, they've had a history of dieting for years and years and years. And now they're probably 2 or 3 stone heavier than they were when they first started to diet. And we say, well, do you understand why has that happened? And we explain why that has happened. And we say, it's not about calorie counting, it's the type of foods you eat that is a difference. So if you are eating foods that don't put your body into fat storage mode and allows you, your insulin levels reduce, and that allows you to go into fat burning mode, then your body doesn't need to go into dietary compensation mode and reserve calories. Instead, it opens up your fat stores. And so when you are intermittent fasting and not eating as much, your body isn't starving because you're being fed. You're being fed from your stored fat in your body, and then your body doesn't have to reduce its metabolic rate. So, it's about the type of foods you eat, not just about calories. And when they understand that, and we explain that quite a complex thing using visual aids, and you see that light bulb moment, and it gives them hope. And we have tears sometimes in the sessions because people say, why has no one ever explained that to me before? And they go away with hope, and they go away motivated, because now they're starting to understand where they went wrong, and that wasn't their fault, but now how they can turn things around and get more success.
That's amazing. I don't know how many people we've talked to that are working with the public health collaboration, but that theme of hope comes up pretty much every single time with the Unwins or with Aranda Wickramasinghe or Olivia Quadja. Like, there's so many people that we've talked to, and they all come back to that one thing. We're providing hope. We're giving you a different paradigm that can actually get you out. Because you're right, these people, it's not for lack of trying. They have tried. They have followed the advice that they've been given. They're not lazy slobs. They're trying their best. It's just bad advice.
Yeah. And that the things like, breakfast is the most important meal of the day. When you explain people that you get a peak in cortisol when they're waking, and that releases some glucose from the liver, and people are fed whether they physically put food in their mouth or not. And they say, well, we thought breakfast was the most important meal of the day. And then the message, eat frequent and often, that just keeps the insulin levels up, so it keeps people in fat storage mode. So, there's so many incorrect statements going around that are still being told to patients. And we just try to, kind of turn it around and provide them with evidence-based and correct information.